We have Bob Lynn, sir, that just joined us.
Okay, thank you. Bob, you hear us all right?
Hear you just great. Thank you.
Okay, you as well. So with that being said, we have the six Assembly members here. France, can you please start the countdown?
I will. We'll be starting. And actually, sir, I'm going to go ahead and start the call and tell you when to begin because I have a bit of a delay on the call and I don't want to miss the beginning of the call for you. So let me go ahead and start and cue you, okay? One moment, sir.
Okay.
You may begin, sir.
So no countdown, we're online?
You're live, sir.
Okay, thank you. I will call the meeting to order. It is a special meeting today. It's 10 a.m. on February 23rd, 2021. Clerk, please call the roll.
Mark,
Here.
Jeff,
Here.
Dave,
Here.
Jay,
Here.
Chelsea,
Here.
Taylor,
Excused.
and Bob.
Here.
Okay, we have six Assembly members present today. This is a phone call meeting. And entertain a motion to approve the meeting agenda as presented.
Mr. Mayor?
Member Mucci.
Yeah, I'd like to add under Communications 6B, just a short conversation about a couple of letters we got yesterday.
Okay, so when we get to that point, go ahead with your input on that topic.
Thank
you. So with that being said, we now have a report of other officers, persons to be heard related to the agenda. And before we start that, when you call in, the clerk will have the operator unmute you. You'll have 5 minutes. At with 30 seconds left to go on your testimony, you'll hear one bell, one ring. It gives you 30 seconds. When you hear the second bell, or double bell, 30 seconds later at 5 minutes, we'll ask you to finish your testimony. And during your testimony, you will be addressing the entire assembly. So don't be pointing your comments at one or two or individual assembly members, and please keep your testimony cordial. So with that being said, Clerk Thompson, will you unmute the first caller? Have the operator do that, please.
Yes, France, if you could please unmute Chris Medallion.
Can you hear me?
Yes, you're coming in very clear, Chris.
Hi. Okay, thank you. Last evening, when one of the assembly members said that we should all just take a breath, I thought that I would actually like to take a breath of freedom. I want to have the freedom to think and make choices for myself. I have no problem with the assembly making recommendations, like our governor and the state of Alaska have done, but I want the choice to determine if those recommendations are in my best interest and act accordingly. Experts are finally predicting that COVID-19 will become endemic, and we will have to find ways to live with it. It is unrealistic to believe that it will just disappear if everyone is vaccinated. Importantly, not everyone can or should get this vaccine, myself included. I remember when Governor Dunleavy got his COVID vaccine shot, and he said that it may not be right for everyone. We all have to decide for ourselves. There were no guarantees that these various COVID-19 vaccines would protect you from contracting the disease 100% of the time or keep you from transmitting it to others, and we are now seeing this. There have been serious side effects reported locally, including deaths nationally and internationally. These are experimental vaccines still in phase 3 trials, which will not be completed for another 2 years. I will not take a vaccine for COVID-19, and I have very important reasons for this choice, and so do many other people that I know. I don't have a problem if someone else wants to get vaccinated. I assume that they are aware of the identified risks and accept that choice for themselves. For the hundreds of times that I have heard the adjectives safe and effective used to describe this experimental vaccine, when those two words are combined with the word treatment, The information is ignored or at worst censored. To effectively deal with this pandemic, we need to embrace early outpatient treatment. But for this past year, all you hear is that there are no treatments for COVID-19 outside a hospital setting, and that is a downright lie. There are multiple effective supplements and repurposed medications which can be used, some of which include vitamin D, zinc, vitamin C, and quercetin. Hydroxychloroquine and ivermectin have been shown to be safe and effective treatments through multiple national and international studies. One of the reasons that they have not been enthusiastically adopted for use in the United States is that they are inexpensive generic medications that can and should be used on an outpatient basis. They have been found to significantly reduce hospitalizations and symptomatic disease. Ivermectin can be prescribed for prophylaxis, in early treatment, and for severe illness through antiviral and anti-inflammatory mechanisms. If you want to find out more about ivermectin, there is a wealth of information on the FLCCC website. So that's capital letters FLCCC. We need to look beyond restrictive mandates to supportive and positive measures that we can take to deal with this pandemic. Thank you for letting me speak.
Thank you for your testimony today. Clerk Thompson, will you have the operator unmute the next caller?
Yes, France, if you could please unmute Sunny Rice.
Hello?
Hello, you're coming in very clear.
Okay, sorry, thank you. I'll be brief. First, I wanted to take the opportunity to thank Carl, the EOC, and the entire Assembly for your energy throughout this entire pandemic, on top of the stresses that all of us are facing in our day-to-day lives. You guys have added all of this, so thank you. Your good deeds are not going unnoticed. I want to speak briefly in support, in particular, of the mandate number 6, which is about travel testing. I think this is low-hanging fruit. I think it affects relatively few people, and it can make a really big difference for the community. I think it has gone, up until recently, a long way in helping all of our residents breathe easier, and I encourage you to please continue with it. Thanks so much.
Thank you for your testimony today. Clerk Thompson, will you unmute the next caller?
Yes, France, if you could please unmute Michael Truex.
Yeah, can you guys hear me?
Yes, you're coming in very, very clear.
Okay, excellent. Thank you for taking my call. For the first time since the coronavirus came into the news over a year ago, I'm a little scared. I'm scared because our public health officials and borough officials are pushing a vaccine which is actually still in the experimental stages of use. Did you know that phase 2 animal testing was completely skipped for these COVID vaccines? Did you know that 1/3 of our town is now enrolled in phase 3 of a vaccine trial by taking the vaccine? Were you told that you were enrolling when you took the shot? I'm further concerned because I'm looking at an open letter written by the UK Medical Freedom Alliance on the 30th of January. The letter, it includes anecdotes of many nursing homes with major catastrophes having occurred immediately after their vaccination campaigns. More importantly, the letter shows quite a few graphs depicting a marked uptick in COVID-19 deaths found in every country which has started vaccinating heavily. Yes, I did not say an increase in cases, but an increase in deaths. This letter can be seen at ukmedfreedom.org or email me at mtruex@gmail.com and I can send it to you. Are we stepping out of the heat and into the flames? I think a longer, more open dialogue would be wise for us locally. Pushing local vaccine injuries under the rug to protect the vaccine does not protect the public. This is an experimental, possibly dangerous, and for-profit medicine. I would urge you to please stop using public funds to push these experiments as scientifically sound, proven medicines. I'm further concerned because so many real solutions continue to be pushed under the rug and debunked. Ivermectin, hydroxychloroquine, and intensive vitamin regimens utilizing vitamins A, C, D, and iodine have been extraordinarily effective in fighting this illness. Exercise, eating healthy, nutrient-dense foods, and getting your immune system functioning at top level is certainly the only thing that has truly proven itself, as individuals in this condition rarely even have symptoms. Sadly, I've never heard our hospital staff mention these alternative avenues of outcome improvement. Remember, the vaccine has never been about preventing transmission. Its makers claimed a 95% effectiveness at reducing mild symptoms, but none of these mandates are about reducing mild symptoms. A closer scrutiny of the numbers from Pfizer trial reveals an absolute risk reduction to an individual inferred by the vaccine to be only around 0.4%, hardly the 95% picture they've been trying to paint. This does not in any way justify the unknown risks of enrolling in an experimental vaccine trial. Please realize that medical freedom is more important than being popular. By allowing all of us to choose what is best for our own health, you will have the healthiest population and the best outcomes for all. Thank you very much.
Thank you for your testimony today. Are there other speakers in the queue, Clerk Thompson? If there are, please unmute them.
Yes, France, if you could please unmute Christina Span.
Hello, can you hear me okay?
Yes, you're coming in very clear.
Thank you. So first off, I want to thank you for allowing this opportunity to express my thoughts on today's agenda. As a new member to this community, I hope my insight will be welcome with open hearts and minds today. So moving your whole family in the middle of a pandemic to a place you've never even heard of can be quite the nerve-wracking experience. But once I reached out and started to prepare for our move and heard nothing but wonderful things about Petersburg, the nerves were soon replaced with excitement. Once we got settled here, we kept hearing, this isn't normal Petersburg. You're not getting the normal Petersburg experience, over and over from various members of the community. And while that may be true for those people, unfortunately, this is all I know of Petersburg. And over the span of 6 months, I have heard and witnessed a great divide in this town. Taking care of a community and keeping people safe stretches further than just COVID and physical health. It includes mental and financial health as well. I've heard from many people who do not support these mandates on today's agenda, but do not want to speak up because, one, they don't want to make waves in the town that they love so much, and two, they don't think you on the assembly are listening or even care anymore. We can hear the annoyance in some of your guys' voices to the people that speak out in opposition to these mandates, and we, the citizens, can only hope and try to trust that you are genuinely listening to our concerns. So I ask you to please consider moving forward with the rest of the state of Alaska and not allowing today's mandates to be passed. Thank you.
Thank you for your testimony today. Clerk Thompson, will you unmute the next caller?
Yes, France, please unmute Courtney Truex.
Okay.
Hello, you're very clear.
Okay. Thanks for hearing me today. I would simply like to voice my encouragement for the Assembly to follow our governor's lead and call off the emergency ordinances. Additionally, I have some questions. Why is the experimental emergency authorized vaccine being advertised as the only solution for our path towards community health? Why doesn't the EOC advertise for highly effective and safe treatments like ivermectin or hydroxychloroquine, or all the abundant preventative measures people can take like high doses of vitamin C and D? Please consider all the voices of your community, even if they don't fit into your personal narrative. Healthcare, both personal and community, is not a one-size-fits-all. It is a balancing act that requires diverse perspectives and approaches, and we need to respect and honor that diversity, not belittle, badger, and coerce people into your narrative. Thanks for listening.
Thank you for your testimony today. Clerk Thompson, please unmute the next caller.
France, if you could please unmute Caitlin Robertson.
Yes, hello.
Hello, you're coming in loud and clear.
thank you guys for your time and consideration and listening to your community members. I just wanted to add my peace of mind. Prior to moving to Petersburg, I've worked as a registered nurse for several years. I have sworn to do no harm. And as a God fearing American, mother, and nurse, I've always respected and recognized the importance of medical freedom. I've personally given hundreds of vaccines, and I've still recognized and respected the importance of medical freedom. Today, I'm calling to protect those medical freedoms and the well being of this community. Not only are these mandates infringing on our medical freedom and constitutional rights, it cannot be expected to comply with a mandate based off Alaska's state advisory, particularly in regards to testing for COVID 19. These mandates will further devastate the Petersburg economy as well. Travelers will simply plan a trip elsewhere in Alaska. Your community survives and thrives from tourism. Those visitors will not come to Petersburg knowing they have to test, obtain written permission from the public health officer to get underway on a boat, and jump through other hoops expected of these mandates. Many other states, as well as many other Alaska communities, have come to realize COVID-19 is not going anywhere. It is common knowledge that a virus will run its course. There is no stopping it. Many are realizing that COVID will be a part of our lives, just like influenza every year. We do not expect influenza to not show up every year. We do not expect influenza vaccine to stop influenza every year. It is not sustainable to mandate our way through another year of PCR testing that are far from accurate, quarantining of the healthy, and masking of the healthy. We cannot stop our children's lives from a virus that largely affects them, or teach the next generation to live our lives in fear of their environment. All for a virus that cannot be stopped, but has a mortality rate of less than 0.5% for most of our population. We must get back to common sense practice. Let the people make their own decisions. If you want your community to trust their leaders and to listen to their leaders, stick with the truth. Stick with the whole truth. We should all take concern of our community, not only those fighting COVID currently, but those also have concern for those who are still suffering for adverse effects of the vaccine. Mind you, this is a vaccine that is not fully FDA approved. It's only approved under the emergency use authorization. And the FDA states in their press release that this is an investigational vaccine. This is a great community that should feel wholly informed. I implore you to please listen and act on behalf of the calls you're receiving today. Thank you so much for your time.
Thank you for your testimony today. Clerk Thompson, will you unmute the next caller?
Yes, France, please unmute Tasha Spurl.
Yeah, can you guys hear me?
Yes, you're coming in very clear.
Okay. Well, good morning, council members and Mr. Mayor, and thank you once again for your time. So COVID cases, hospitalizations, and deaths have been reported locally, but not vaccine injuries, adverse reactions, or any local statistics for the vaccinated that are COVID positive. If you're going to paint a picture for us, please paint the whole picture. We do deserve transparency and honesty. The World Health Organization holds that asymptomatic spread is, quote, extremely rare. When the City Council and Petersburg Medical Center are willing to accept this fact, the citizens of Petersburg can start to heal emotionally and treat each other with the respect that is decent and human. We had COVID in December in Montana. We were actually sick, not asymptomatic. The 4 in our group that got tested were all positive. The Montana Health Department doctor told us that once we contracted COVID, that we should get written proof so that we wouldn't have to test for the next 3 months, because if tested, we likely would come up positive even though we were no longer contagious. Many asymptomatic cases are what I have just described above, previous infections no longer contagious. Let's drop out of the case-demic and start talking about cases that are actually ill. Thank you once again, you all, for your time.
Thank you for your testimony today. Clerk Thompson, will you unmute the next caller, please?
Yes, France, if you could please unmute Dana Tinas.
Hi, can you hear me?
Yes, you're coming in clearly.
Good morning. Thanks for hearing me. Our medical center has lost the trust of many of us in the community. Our emergency command system and borough assembly no longer have our confidence. Therefore, my appeal this morning is to the people of Petersburg, those who can still weigh evidence and think for themselves. SARS-CoV-2 is a virus. Even if it is a particularly nasty one, we have to go through it. We have to meet it and be prepared to meet it with our immune systems as strong as we can make them. The experimental vaccines will not stop this virus. Even the vaccine manufacturers have said they do not know if viral infection or transmission will be helped by the vaccines. They are waiting for their test group to show them. All of you who've taken the vaccine are the test group. Are you worried about contracting this virus? Boost your immune system. Vitamin C, lots of vitamin D, quercetin, and zinc. The action of quercetin resembles hydroxychloroquine, yet it is a mild over-the-counter supplement. Both hydroxychloroquine and quercetin help zinc get into the body's cells, and when there's enough zinc inside the cell, the virus cannot reproduce. If you actually get COVID-like symptoms, many doctors, even here in the United States, suggest hydroxychloroquine or ivermectin. The nice thing about these very safe medications is that they also act prophylactically as preventive, with as little as 1 tablet a week. Think it's not available? Think again. Telemedicine has made you a free person. Go to speakwithanmd.com, speakwithanmd.com, and you will be able to get a doctor to call you back who's licensed to prescribe in the state of Alaska. It's sad that we have to do this. Sad that our local medical center has lost the trust of so many of us. You have surely heard that hydroxychloroquine is dangerous, but before this lockdown began, it was known to be super safe. In other countries, hydroxychloroquine is over the counter. There were 3 big-name studies that came out which seemed to show harm: Lancet, New England Journal of Medicine, and JAMA. With the JAMA study, they treated very sick patients in the final stages of illness and used doses known to be lethal. Criminal investigations are ongoing into 27 scientists over the deaths of those patients. The Lancet and the New England Journal of Medicine papers were retracted, but I'll bet you didn't hear about those retractions. In the meantime, there have been over 80 favorable studies showing the benefit of hydroxychloroquine. You may wonder why I've submitted this message to the Assembly with little mention of mandates and lockdowns. It's because the Assembly meetings are just about the only open public forum left in this town, and they're not really a dialogue either. At no time during this horrible lockdown have discussion and dialogue occurred in Petersburg, only top-down dictates. A friend and I tried to share this life-saving information with Petersburg several months ago on KFSK, but we were banned from airing it. I tried to share this kind of thing, this kind of information on the Petersburg COVID Facebook group, but rather than have this information discussed or even countered, I was banned and blocked. There are people in this town who apparently only want you to know what is repeated ad nauseum by CNN, NPR, and other approved news sources who seem to be working hard to frighten you day after day into a state of paralysis and compliance. Soon they will have you walking on all fours if someone in a white coat declares that to be the way to dodge the virus. Because our hospital, our radio station, and our assembly ignore and silence any information and suggestions that counter the prescribed narrative, I advise those of you who are ready to turn off the television to visit livefreealaska.org. Thank you.
Thank you for your testimony today. Clerk Thompson, will you unmute the next caller, please?
Yes, France, please unmute Sarah Reed.
Hello, can you hear
Hello?
me?
Yes, you're coming in clearly.
Okay, hi. I just got a couple of questions for the Assembly, the EOC, and the hospital. And forgive me if this is not the right platform to ask such questions, but the 3 of you seem to be so intertwined on these matters. So here's my first question. In regards to all the new cases popping up in town just this past couple days, when those people are being tested, are the tests being spun at 45 cycles during the PCR testing? Last I heard, they are testing at 45 cycles due to the manufacturer's directions, but the CDC and the WHO have come forward with information of spinning it that many times picks up dead or fragmented particles of the virus, which have no ill effect to a person or a population. At that point, it is not transmittable. So, is Petersburg Medical Center addressing these situations of potentially creating a larger scare than necessary? And if so, how are they making sure that a positive case actually equals a contagious case? I would really like to know the answer to that. If you guys have an answer to that. And the second question I have is if you guys could help us to understand your avenue, your logic of pushing an experimental vaccination on Petersburg, on the citizens here. Why it's being pushed so hard, even to the point of making it so that a vaccinated population has the rights to a medical treatment first over the population that has chosen not to take the experimental vaccination. When it's reported, even by the CDC and the WHO, that after being fully vaccinated, you still have to wear a mask, you still have to quarantine, and they're not sure if you can spread COVID or not, or how long you may even be protected. So my second question then is, why is this experimental vaccination being pushed by all of you so hard, and it feels like it's going down a very dangerous and slippery path, letting vaccinated people get treated at medical center over the unvaccinated on an experiment? So if you could answer those questions, I would really appreciate it. Thank you.
Okay, and you're absolutely correct, Mrs. Reed, that this isn't the platform for question and answers, but I would hope you will get answers to your questions from the people that have those answers. So Clerk Thompson, will you unmute the next caller, please?
Yes, France, please unmute Brittany Collum.
Hello, are you there, Mrs. Collum?
Yes. Are you guys, can you hear me?
Yes, you're coming in clearly.
Okay, very good. So I'm calling in today about the mandates. I am asking again that those be lifted. And I know that this is not on the agenda for today, but if possible, it'd be great if we could also lift the masking mandate. But kind of going through what I want to say today, I've said before how this all these mandates is overreach of the borough in our lives, because people have done research, as you've heard in the testimonies today, and we have found that masking and the vaccine are really not effective ways to keep you healthy from COVID or any other illness for that matter. And I'm asking you guys to step back from kind of trying to take the lead of medical avenues we should take in our lives, because we are smart and we can be informed to make our own decisions. And I'm also wondering why you are not listening to the people that have called in repeatedly, and also the 500 signatures that were submitted against this whole emergency ordinance when it was first put in place. I'm wondering what the ulterior motive is, because that's kind of the question that's popping up now. Is it money? Why is this fear continuing to be kind of pushed in our faces all the time? And I also would ask, let's look at this with common sense. The line of success keeps changing. At first it was, we're going to flatten the curve, and oh, nope, now you need to stay home, and oh, actually it's going to be a year from now when you guys are still going to be masking, and the vaccines don't really help you either because you're still sick and testing positive and still have to wear your masks, and oh, actually maybe you should wear 2 or 3 masks. So it's getting pretty ridiculous to me, just kind of watching this whole thing unfold. So I am seeing it all as kind of ridiculous at this point. COVID, like I mentioned before, and everyone else has said too, it has a very high survival rate, especially if you take these, I'll say ulterior forms of medicine, but they're really not, like the hydroxychloroquine and the ivermectin, rather than going the vaccine route. Ventilators are kind of used as this scary thing, but really those are not the best way to go from what I've read and seen. and it's kind of the last resort. So if you can keep yourself healthy, and of course that's not going to be the case for everyone, because like any virus, like the flu, there is times when it's serious. But that's where we can't live our lives in fear, because there's going to be things that you are going to face, and you can't keep hiding from it. And as another caller said too, this virus is not going to go away. Viruses don't just disappear because you mask and stay home. So I just ask that we return to a somewhat normal life and face this the way we face the flu or a cold, and just use common sense and stay home if you're sick. And of course, yes, wash your hands and don't sneeze on people, but that's where common sense seems to have gone out the window. And I'm seeing that especially with the EOC and with the hospital, and even with the assembly at this point, because all these testimonies are falling on deaf ears so far, and it's really disheartening. And it kind of makes you wonder, I mean, is it better to move to another town, because this town seems to have lost its mind in a lot of respects. So I just ask that you would hear us today, and please take action accordingly. Lift these mandates, and let's move on with life, and set a better example for our children, because this is crazy. So thank you for your time.
Thank you for your testimony today. Clerk Thompson, will you please unmute the next caller?
Yes, France, please unmute Kelsa Spurl.
Hi, can you hear me?
Yes, very clear.
Awesome, thank you. First off, I just want to say thank you for letting us all call in today. I haven't called in yet, but I, as a third-generation Petersburg resident and one of the young people in this community, I just wanted to say a few things for you guys on the council, but also those listening. I wanted to say there's a fine line between caring and controlling, and I feel like Petersburg crossed it a long time ago. And growing up here, I have a lot of good memories of this town, and whether it's calling into Tradio or playing live music with others or just doing school fundraisers. And I always loved how supportive and caring this town was. And I honestly always believed that this is where I wanted to raise my future family someday. But it's quickly becoming no longer the case. When I moved back from Montana this past winter, I had hoped that Petersburg had started to heal and get back to some normalcy like the rest of down south was trying to do. But when I stepped off the plane, I was rudely spoken to, told I was wrong, which I wasn't. I had followed all the required steps online. But still, I was followed and yelled at. And being gone for months, that was just not the homecoming that I had ever pictured I would have coming back home. Anyone who knows me knows I'm not a confrontational person, but it's gotten to the point where I just don't want to be here, here in my own hometown, and that's just kind of sad. Correct me if I'm wrong, but the CDC still says social distance or wear a mask. Many around here act like if you don't do both, you're going to be the reason someone dies. And I'm sorry that some people feel that way, but please just do a little research and look at real data and don't just go off of fear. Some of us want to get back to normal. And if I see you downtown with a mask, I will move out of your way and keep 10 feet of distance if that makes you more comfortable. Please, can we just start doing more caring than controlling and try to move forward like we've seen the rest of the state trying to do? That's all I have to say. Thank you for your time.
Thank you for calling in and giving your testimony today. Clerk Thompson, will you unmute the next caller, please?
Yes, France, please unmute Craig Anderson.
We do not have him connected at this time.
Okay, let's move.
If he calls back,
Sorry.
if he calls back in, we'll put him on the phone. So please unmute the next caller, Clerk Thompson.
Yes, thank you. France, please unmute Micah Hasbrook.
Good morning, everyone.
Good morning. You're coming in very clearly.
Hi, good morning. Because I do not support indefinite mandate extensions. I'm a critical infrastructure worker who works under a strict COVID mitigation plan. I travel to and from work twice a month. This constant testing and quarantine cycle are not maintainable anymore. As we all know, the PCR tests were not designed to actually diagnose COVID-19, and it's my understanding that PMC is running their tests at 45 cycles. Those of us in these regular testing programs are bound to get a false positive at some point, as we have already seen in the community, even if the medical center refuses to call it that. If I have to continue testing at this rate, how will the borough pay my bills when I'm not allowed to go to work because this test with little credibility told me I was sick? If I have symptoms or am exposed, I will quarantine and seek medical guidance. The interstate travel mandate in this community is not only feeding into the pandemic fatigue that we are all feeling, but this assembly and the medical center and the EOC are creating a huge divide in this town with the lack of transparency they're all operating under. I do not support the extension of these totalitarian mandates because this borough has proven itself untrustworthy to manage this pandemic truthfully and logically. Those who have stepped forward to help with actual solutions and preventative measures have been canceled. The medical center and EOC are not being truthful about the vaccines or the true nature of the hospitalizations. Here's a fact for you. Petersburg has had more people with serious adverse reactions to the vaccine than to actual COVID. And this fact has been swept under the rug, and HIPAA is used as a scapegoat. For example, we can be told when a patient is on oxygen in the hospital, but they refuse to inform the public when someone has had an adverse reaction to the vaccine. I do not support this assembly in voting to prolong any mandate that the state of Alaska has dropped. Lastly, I would like to remind you that when you put these mandates in place this spring, you said you would be following the state's lead on when they would be dropped. Here we are. Please stop the totalitarianism in the name of health. Thank you.
Thank you for your testimony today. Clerk Thompson, will you please unmute the next caller?
Yes, France, please unmute Bridget Davidson.
Are you there, Mrs. Davidson?
Oh, sorry, I didn't know. I apologize. Yes, I'm here. Can you hear me all right?
Yes.
Okay. My statement today is short and simple. It's just one sentence. But I know my voice is very important today, and I just implore you not to vote pro on the proposed mandates today. That's all I have to say. Thanks.
Thank you for your testimony. Clerk Thompson, will you unmute the next caller, please?
Yes, France, please unmute Dawn Engel.
Hello?
Hello, you're coming in clear.
Hi, I am just calling to say I appreciate you guys and what you're doing to keep our community safe. Personally, this has affected me and my family. I lost my dad in October with COVID, and to watch somebody suffer like he did, he wasn't ready to die. It wasn't necessary, but it is what happened. It happened. But for all the people calling in about not masking, you know, that's your choice. I get it. But for all the people that want to mask, you know, we're just trying to keep all the people safe in this town. It's not against, nobody has to be against each other in this cause of trying to keep people safe, because it's a very, very hard thing to watch and see somebody suffer. And when you can't go say goodbye to your loved ones, you all might think differently about it. And I've had other family members affected by it. And right now, it is happening in this town, and people are getting sick from it, that I know for a fact. So I just want to say that I do support the mandate, and I just want to thank everyone that is trying to keep this town safe. And I really appreciate everything that everybody has done, the medical staff, from vaccination to, and it's your choice to get the vaccination. Nobody's forcing anyone to get the vaccination. That is a choice made by an individual. So you don't have to get it if you don't want to, but, you know, it doesn't mean that people are being forced to get it in this town, because they are not by all means, you know. And I just wanted to put my sense out there that it is real and people are suffering and personally affected by it. I just don't want to see anybody else's family go through what I went through. So that's all I have to say, and thank you very much for listening.
Thank you for your testimony today. Clerk Thompson, will you please unmute the next caller?
Yes. France, please unmute Will Ware.
Yeah, good morning.
Good morning. You're coming in.
All right. Hey, thank you. Thank you. I am calling in just in support of the visitor industry vote and discussion on the mandates that you may be taking on today. I would ask, I think the Chamber sent a letter to the Assembly asking to postpone any decision or votes in regards to the visitor industry coming up this summer. As the stakeholders, as a business owner, as a member of the Chamber, primarily the stakeholders, would love to be able to take a look at what is being voted on prior to it being voted on. We were made aware as a Chamber, we were made aware as business owners that there was some documents that were out there that may affect the visitor industry via mandates and trying to get some uniformity across the region. I don't know that anybody's against that, but we certainly, as business owners, would definitely like to take a look at it and have a weigh-in before the Assembly votes on a direction they'd like to go regarding the summer tourist season. And that's all I have.
Thank you for your testimony today. Clerk Thompson, will you please unmute the next caller?
Yes, France, please unmute Maura Phillips.
Hello.
Hello, you're coming in very clear.
Hey, good morning. I usually don't call into anything like this or give my 2 cents worth, but I've been listening and all I've been hearing mostly is one side of what you guys are looking at. And I know that people in our city, in our schools, in our medical have been working very, very hard, day and night, with honest hearts. You know, they're not doing anything to try and split the town. They're really trying to keep us safe. And I know people in those fields and others have just been working really, really hard. And a lot of them aren't calling in right now because that's where they're at. They're working. You know, I know people that have given up weekends, nights, everything to try and keep our town safe. And I just really wanted to call in and thank you all for doing that. And I appreciate all your hard work and the time you've sacrificed from your families and your personal time. And I just want you to know that what you're hearing is not all what the town thinks, that many that think, you know, they're doing the best they can for the town are not able to call in because they are working at school or at the clinic or at the hospital or at the city. And I just wanted to call and share my feelings with you, and I appreciate all that everybody's doing to try and keep us safe and healthy and a town that's still able to work, and just appreciate it. Thank you so much.
Thank you for calling in this morning. Clerk Thompson, will you please unmute the next caller?
Mayor Jensen, I believe that is all we have for today.
Okay, and Mr. Anderson has not tried to call back in?
I do not see him in the queue.
Okay, well, we will move on to the next agenda on the item, and that's item 4, report of other officers. And today we have a report from Mr. Hagerman from the Emergency Operations Center.
Yes, hello, Mr. Mayor and Assembly. Thank you. So I first want to apologize for not having a written report to you. A lot been happening lately, a lot of activity to keep up on. I'd planned to do that, but the weekend was lost to me to respond to the outbreak that we've got going on. And so I did want to update the Assembly real quickly on the outbreak. as I'm sure you know, the EOC did raise the community risk level to red yesterday. We had bumped it up to orange on Sunday because of the developing outbreak, and it just continued to get worse and worse yesterday. So we did meet yesterday morning and decide to raise the community risk level to red, and we put out a press release to that effect. Got on the radio at noon and put out a code red message to the community late in the evening to let everybody know. This outbreak is extremely serious. The width and breadth of the outbreak is still not fully known. The staff at the hospital and the public health nurse office is working extremely hard trying to complete contact tracing and really get a handle on where the close contacts may end. In this small community, the affected groups of people, businesses, other agencies is just growing every day. As of this morning, we have I think the official count, which has been hard to keep track of, is 24 local COVID-19 cases, with 2 other cases that are outside of Petersburg presently. And with a long list of close contact testing to complete to fully get to the bottom of the pandemic, or of the outbreak. I just want to implore the community, no matter how you feel about the progress of or the reaction, the response of the EOC and the hospital, please do your part to buckle down, to mask if you haven't been, to move in smaller circles, to avoid crowds. That's the way that we're going to be able to end this outbreak. The longer this outbreak goes on, the more impact it's going to have to businesses and agencies and our economy. We really need to stem it as quickly as possible. I don't have any answers to some of the questions that were brought forward today, but I would, if Phil Hofster's on the phone, maybe if the mayor is okay, just allowing Phil to say a few words from the hospital's perspective about the outbreak.
That sounds good. Mr. Hofstetter, are you available?
Yes, can you hear me okay?
Yes, you're coming in clear.
Yeah, I'll just say a few words. Our staff are working double, triple time. It's really challenging to see, and I'll just speak to the severity. When we look at the number of cases, as case counts go up, statistically speaking, we're pretty much on track with the national averages that we're seeing, or national standards that we're seeing for percentages of severe COVID. We're probably a little bit above that. So of the 81 cases, we're seeing in the last 6 weeks, we're seeing more admissions. We have had 4 inpatient admissions. One of those was a medevac out to a higher care facility. We're seeing more symptomatic cases. We have had 10 treatments of monoclonal antibody, which is a scarce resource that the state has provided for treatment. So we're seeing an uptick in severity with the cases, which is very alarming. And again, everything that we're seeing in the community has an exponential impact to our staff. It's just really hard. It's just really hard to see this. I can understand how public health officials kind of break down in front of assembly meetings throughout the nation in this COVID, because it's very difficult to see. It's very, very preventable. That's what's hard. It's just very easy to mask. And if you electively want the vaccine, that's available as well. There's a lot of misinformation out there. And we're going to have a focus in the next couple of days on trying to provide improved clarity on some of these information and some of the things that are being thrown about inappropriately in the community. So And that's pretty much all I got to say.
Okay, thank you, Mr. Hofstetter. Mr. Hagerman, do you have anything more to add?
Yes, thank you, Mr. Mayor. Now, I know the purpose of the meeting today is to discuss mandates, and so I wanted to go down the list and just offer a couple words on each one of those before the Assembly's deliberation. So, and just as a little bit of background there, I think the Assembly knows that the state's emergency declaration did expire a little over a week ago. The reason for that expiration wasn't in my opinion, wasn't a legislature and governorship acknowledgement that the pandemic is over. It was a political game, in my opinion, that it did not get extended. There is a lot of support at the legislature level for an extension of that emergency declaration. But just the way that the legislature works, the votes weren't there for that to happen. And anyway, so the EOC's goal with these mandates before you today is to continue with the same level of protection that was provided to Petersburg before the expiration of the state's mandate, or excuse me, declaration. And so to that end, a lot of these were in place before the ending of the state's declaration. One of those, of course, is the mandate number 5, which is the harbor access, what I call the harbor access mandate, that requires small vessels coming into Petersburg carrying passengers, and mostly what we're talking about here are the smaller cruise ships that come in during the summer. That those ships make contact with our local health officer and detail the status of the passengers and crew's health on board, and get approval from the health officer to disembark and enter our community. And this mandate is it's fairly straightforward and commonsensical in that we want visitors in Petersburg. We want people to come and enjoy our community, but we would rather that they not bring the virus with them and impact other people in our town to do that. So this mandate helps to protect us in that manner and put some authority in the health officer's hands to make sure that the people that do get off the ships are healthy and that Petersburg is not adversely affected. Another mandate is the submission of travel plans. This is a mandate that addresses a fact that the state required critical infrastructure businesses that are traveling into remote communities to provide mitigation plans, travel mitigation plans to the state. And the borough, early on, quite some time ago, kind of piggybacked on that and requested at the same time that those plans be supplied to the EOC. And so we didn't have any approval authority over those plans, but we did get a number of them, and we're able to start that dialogue, conversation between the EOC and visiting companies, and see what their plans were for protecting Petersburg, and make suggestions if we saw any holes, and we were able to provide a lot of information about if they did have a technician or somebody coming into the community that did get sick, who they could call, where they could seek treatment, that kind of thing. And so I think that mandate has also been very helpful, and we're recommending that it be passed today. The Emergency Health Directive number 7 is for the non-congregate sheltering program, and this program has been little used, but it is a very good insurance policy. It's a very low-cost insurance policy as well. FEMA does pick up the cost for the rooms that we have reserved at the Narrows Inn. Those rooms would be used for a homeless person that is waiting for a test result or actually tests positive for the virus and needs some place to isolate. It's in my opinion, a very good idea to maintain that program just in the event that a positive of a homeless person does come up, that that there's some place for them to go, and we would shelter them and feed them for as long as it took to for them to overcome their infection. That program also extends to first responders and healthcare workers if there is a need to shelter one of those folks. That would also be part of this program. As I said, FEMA picks up all of the cost for that, so very little monetary issues for the borough in that one. The mandate number 9 is concerning intrastate travel. That's travel within the state of Alaska into Petersburg, and we would like to extend that. That's a mandate that had been in place before the emergency declaration expired as well, and so we'd like to continue that so that others that are in Alaska, just because you're in Alaska doesn't mean you're less susceptible to catching the virus and bringing it to Petersburg. This mandate helps protect us by testing people that are coming from other Alaskan communities in Petersburg, and I think it's important and worthwhile extending. The last mandate on your list today is mandate number 10, which is basically a replacement for the state's interstate and international traveler mandate that they had in place before the declaration expired, and it is very, very similar to that mandate in that screening and testing is required from people coming into Petersburg from out of state. And the last two mandates are very much held up by the airport testing contract that is in place between the borough and the state of Alaska. That contract is in place, and what we've heard that the state will honor the terms of that contract through the expiration date of June 30th. That the funding source for that contract was through CARES funding, the CARES Act funding, and some FEMA support, and those funds have been encumbered, as far as I know, to fulfill all the contracts in Alaska out till June 30th. So that testing contract makes it possible for these last two mandates, the traveler mandates, to exist and not cost the borough any money. It's basically a pass-through for the hospital. They are barely scraping even if they are at all for their efforts up there on the testing side, but we definitely appreciate their participation and providing the testing services as part of this program. So I think that is my report on the mandates, Mr. Mayor, and I'll be on the line if there are any other questions during the deliberation.
Okay, thank you, Mr. Hagerman. And with that being said, we're done with report of other officers, and we're now on to item 5 on today's agenda, and that's new business. The first item under new business is Petersburg Borough Public Health Mandate number 5, Borough Harbor Facilities, Vessel Docking, and Disbursement. I would entertain a motion to adopt this mandate.
So moved.
Second.
Motion's been made by Member Mucci, seconded by Member discussion.
Mr. Mayor?
Member Mucci.
Yeah, I'd like to make an amendment to this mandate.
Okay.
And the mandate, sure, my amendment would be towards the end of the document there under effective date and duration, replacing most of the stuff that is after the words in effect, until, and what I'd like to add, after the word until, rescinded by the Borough Assembly, period. This mandate will be reviewed by the Assembly at the May 17th meeting. That's my amendment.
Is there a second?
I'll second that. Second.
Okay, discussion on the amendment.
Yeah, Mr. Mayor,
Mr. Mayor?
if I can. Oh, go ahead.
Go ahead.
No, I was going to ask you to. No, I was just going to ask Member Mucci to explain this, the why behind it. So I'll just let him go. Thank you.
Member Mucci, you have the floor.
Yeah, thank you, Mr. Mayor. Yeah, my reasoning is here is, the borough assembly can get together at any time and rescind any of these mandates. I know there's been members of the assembly that were concerned about this one specifically, and there was some work being done by the visitor industry and or the tourism industry in Southeast. And this amendment just gives us the ability to, if we think this needs to go away, we can just get together and rescind this mandate. And it also gives us a date to look at, like the May 17th. That this won't go on, who knows how long things will go on for, but at least gives us a chance to look at this mandate specifically at the May 17th meeting and decide if we want to continue it or just have the have the discussion to see if we need to change anything with this mandate. So those are my reasons. Thank you.
Any other discussion on the amendment? And let me make sure the amendment is clearly understood by the Assembly. So this mandate would take away the effective date until 11:59 p.m. on May 31st, and it would be changed to the May 17th meeting for the Assembly to address this again, whether it will be terminated or continued. Is that correct, Clerk Thompson, the way you have the amendment?
I'm sorry, Mayor Jensen, could you say that again?
So do you understand the amendment to be that the Assembly will address this at the May 17th meeting, and this will not be in effect until May 31st, like stated under effective date and duration? Is that the intent and the language in this amendment?
Yes, that is what I understand. Thank you for repeating for me.
Okay, any other discussion on that proposed amendment?
Mr. Mayor?
Yes. Member Mucci.
Yeah, I just want to be clear that it reads that, and it goes after the word in effect until, after the word until, it'll read until rescinded by the Borough Assembly, period. This mandate will be reviewed by the Assembly at the May 17th meeting, period.
Thank you. That is what I have.
The language.
Thank you.
Member Kensinger.
Yes, Mr. Mayor. I'm not opposed to this language, but I'd like to point out that we do have the opportunity to rescind or change any of these mandates at any time as different information becomes available. I'd like to point out that right now the Chamber is working to try and develop language that's consistent with the other communities within Southeast. And I would propose that should be ready no later than the April 1st meeting, in time before we have any cruise ship visitors coming to town. So the intent of this change in language doesn't change the fact that I'll also be putting it on the agenda to review this ordinance at the April 1st meeting.
Okay, so any other Assembly members that haven't had input on this amendment have any input? Okay, hearing none. I think my opinion on this is just to leave it as it is worded, and because of what I agree with what Member Kensinger said, we can rescind this at any time, and I don't think we need to put a different date specific on this. We could address it at the next meeting if we felt it was necessary, or call a special meeting if necessary. So that's my intent on the amendment. So if there's no other comment by Assembly members on this amendment to change the effective date, I'll have the clerk call the roll on the amendment.
Chelsea?
Yes.
Bob?
No.
Jeff?
Yes.
Dave?
Yes.
Jay?
Yes.
Mark?
No. Okay, so the amendment passes, and so we'll change the effective date to until the assembly rescinds it, and we'll discuss it at the May 17th meeting. That's the new language. So with that being said, We're back to the main motion as amended. Any other discussion? Will the clerk call the roll?
Mr. Mayor.
Member Kinsinger.
Yes, Mr. Mayor. I just want to point out that I will be placing this on the agenda for us to review at the April 1st meeting once we've received information from the chamber on what the visitor industry in town, what they've determined to be maybe a different course of action than what's outlined in this ordinance.
Okay, got it. Member Tremblay.
Thank you. Yeah, I just wanted to signal that I'm looking forward to hearing what the chamber is discussing as well as what is happening in other communities. I'll be voting to support this, but I'm looking forward to the ongoing conversation as we get closer to summer.
Okay, any other discussion from assembly members before I ask the clerk to call to vote? Okay, will the clerk please take the vote?
Jay?
Yes.
Bob?
Yes.
Jeff?
Yes.
Mark?
Yes.
Chelsea?
Yes.
Dave?
Yes.
Okay, Petersburg Borough Public Health Mandate number 5 passed with a 6-0 vote. And that brings us to the next item on the agenda, Petersburg Borough Public Health Mandate 6, submission of travel plans. I would entertain a motion to adopt this mandate.
So moved.
Second?
Second.
Okay, it's been moved and seconded. Discussion.
Mr. Mayor?
Member Mucci.
Yeah, thank you, Mr. Mayor. Under the effective date and duration on the second page of this mandate, does there need to be similar wording towards the end of this effective date and duration, similar to the one we just did that says until rescinded by the assembly? I guess I'm asking Carl, I guess, for an answer or somebody. I'm not sure.
I can probably I'll interject my thoughts on that. Carl, I believe, worked with the borough attorney on the language. So with the effective date and duration, it says the mandate went into effect April 20th, 2020, and shall remain in effect during the effective period of State Health Advisory number 4 unless earlier terminated. So do you still want an explanation from Mr. Hagerman?
I don't know, maybe just some clarification, Mr. Mayor. I'm just, since I'm not sure what the State Health Advisory number 4, if we're still under that guidelines, or, I just want to make sure that this is current. That's all. Thank you.
I'm assuming it is, but Mr. Hagerman, can you please answer that question?
Mr. Mayor, I'll try. So the requirement for travel plans and the reference to State Health Advisory 4 did come from our attorney, and she felt that it would be best to tie our requirement for travel plans to that health advisory, just for consistency and to not to provide less confusion about the differences between any state health advisories and our mandate. I think that's the answer.
So currently the State Health Advisory number 4 is still in place?
Yes.
Okay, thank you. Member Mucci, does that answer your question?
Yes, it does. Thank you.
Yeah. Mr. Mayor, again.
Pardon me? Who is this?
This is Member Lynn here. I have a question here, if I could, for Carl.
Sure.
Yeah, Carl, the plan here, I assume, would come under the state process that's already been established, and will that then be shared at the state level? How is that going to operate with the state not passing their, the emergency extension?
So through the mayor, Member Lynn, good question. So the health advisory number 4 requires, it recommends that they're all health advisories now. So the state is recommending that travel plans still be issued to the state EOC for review and approval, I would guess, for any companies that are traveling to remote communities in Alaska. And with this mandate, we're asking as a municipality to receive copies of those plans. And so I believe that we don't get copies of plans from the EOC. We're requesting those plans from the company themselves. We can request plans from the EOC, which has been kind of hit and miss, to tell you the truth. If we were curious to see a plan of a certain company, but the process basically is just a contact with the company that is going to be supplying the plan to the state and to the borough.
And a follow-up question to that: if you receive the plans, and let's say there is a strong, difference of opinion, how's that? I assume we're doing that then through some negotiation rather than some forceful process.
Yeah, there's no forceful process. There's no coercion on that. When we read the plan, if we see any issues with it that may put Petersburg at risk, or if they've left out an important aspect of a mitigation plan that we've seen other companies submit, we'll bring that up. We'll mention it to the company, and I don't know if it's necessarily a negotiation, but it's an open dialogue, for us to communicate how we think that they could protect Petersburg in a better manner. And for the most part, the companies that we've seen plans are open to trying to protect Petersburg and improve their plans as they come to us. So it's definitely not any kind of a force, a show of force on our part. It's a discussion where the final goal is to improve the safety of Petersburg, and most companies are very open to that.
Okay. Thank you.
Any other discussion on public health mandate number 6?
Yes, I have a question for Carl.
Member Tremblay.
Thank you. This is relating to this mandate, but also all the others that kind of have this local tie-in to the state health advisory. I totally agree with your assessment of the larger state statement of emergency. That expired in part because the legislature's own attorneys, I believe, were saying that it was their jurisdiction to continue to be extending these mandates. It was not, or the state declaration of emergency, it was not within the governor's purview. So I actually, in a way, people who know me will be surprised to hear me say this. I'm glad that the governor did not continue to use that. I'm glad that he took that action to revert that power back to the legislature where it belonged. I'm grateful the legislature is now organizing and will be hopefully getting act together so we can continue some continuity in all these important programs. My question is about how that possibly, I'm not fully clear on if the legislature does redeclare an emergency for especially the purposes of getting vaccines effectively distributed, making sure there's smooth passage. I'm concerned about the news that the treatment antibodies from the state, the fact that they're coming from the state has me concerned that those could be potentially waylaid. Carl, do you know if these health advisories could become mandates again if the official emergency is redeclared? Is that something you have any insight on? Just how I'm thinking about if that does happen, how these might get affected, because partly why we're having this conversation is because of the expiration that we witnessed. So if it goes back into effect, how those come together. And you may not know, I'm kind of thinking out loud on that question. Thank you.
Sure. Well, through the mayor, Member Tremblay, that's a good question. It really is unknown right now exactly what would happen if an emergency declaration was reestablished by the state. The way this, the mandates that do refer to the state health advisories as a condition of their existence, would most likely need to be amended again and reissued at that time. And really, there's nothing wrong with, in my opinion, of our elected body taking these up and discussing them. I think as Member Kensinger stated, his desire to bring up the harbor access mandate again in April. It's just good. Things are changing rapidly right now, and yes, if the state does reestablish an emergency declaration for the entire state, this mandate would be affected, but the state might also turn that health advisory back into a mandate itself. This is, like I said before, this is pretty much a piggyback on to whatever the state's process is for receiving those travel plans, those mitigation plans from visiting companies. And so we just want to be included in that as a borough, and that helps us protect our citizens. But as far as the exact question of whether or not the state's advisories will be turned into mandates, that's really hard to. I can't answer that. Cannot answer that at the present time. They've changed the wording. They came out as mandates, and then they turned them into health orders, and now they're health advisories. They've changed things a lot since the start of the pandemic, and it's really hard to say what the state will do as the next step.
Thank you.
Does that answer your question, Member Tremblay?
Yeah, it's just nice to know we're all swimming through mud together on these.
Okay, is there any other discussion on public health mandate number 6, submission of travel plans? Clerk, call the roll.
Jay?
Yes.
Chelsea?
Yes.
Mark?
Yes.
Jeff?
Yes.
Bob?
Yes.
Dave?
Yes.
Okay, public health mandate number 6 passes unanimously. That brings us to item C under new business, Petersburg Borough Public Health Emergency Directive number 7 for non-congregate sheltering. I would entertain a motion to adopt this directive.
So moved.
Second.
Okay, it's been moved and seconded. Discussion. Mr. Hagerman explained this quite clearly earlier when he said that he feels this is important to have in place, and there's no financial burden to the borough. It's funded with federal money, FEMA money, pass-through money, and so I don't see this as being a bad idea, especially since we reduced the number of rooms that we are paying for on a monthly basis. That's my input. Any other discussion?
Yes, Mr. Mayor.
Member Tremblay.
Thank you. Yeah, I just wanted to thank Carl for the clear explanation as well as what you just said, Mayor. And I just think this is an important part of having an equitable response to the pandemic, ensuring that people who are experiencing homelessness have a safe place to recover if they test positive, is an important part of our response as a community. So I'll be voting to support this.
Okay, any other discussion on the Public Health Emergency Directive number 7? Clerk, call the roll.
Dave?
Yes.
Mark?
Yes.
Bob?
Yes.
Jeff?
Yes.
Jay?
Yes.
Chelsea?
Yes.
Okay, Public Health Emergency Directive number 7, non-congregate sheltering, passes unanimously with a 6-0 vote. That brings us to item B, Petersburg Borough Public Health Mandate number 9, intra-state travel testing. I'd entertain a motion to approve this mandate.
So moved.
Second?
Been moved by Member Mucci, seconded by Member Kinsinger. Discussion.
Sure, Mr. Mayor.
Member Stanton Greger, did you want the floor?
Sure. Thank you, sir. Yeah, I'll be voting for this today. Both of these mandates regarding travel testing. No, it's not a perfect system using our airports and ferry terminal for testing, but it's really done its job just like we've asked it to. The goal of that, to be captain obvious here, is people coming to our community, taking a test and following protocols while they're awaiting it. And many of the positive tests we've had in our community over the course of this pandemic have been detected through that. And I think it's fair to extrapolate, as those people have been at home awaiting their results. It's help keep people safe. It's help prevent community spread is best. It's one of the best tools we've got for it. So I'm glad we can keep that, and I'm glad it's free to the public to take that up. And I've heard some complaints, from people about that, and having to go through the tent and just the whole process thereof. And I don't mean this in a joking manner. It just reminds me of having flown internationally. Like, it's nothing compared to customs. It doesn't cost you anything, and people are very polite and helpful. And having done it myself, I was in and out of there in 5 minutes, and I was grateful to have that service provided for us. So I'll definitely be voting yes. Thanks.
Any other discussion? I thought I heard one other assembly member want the floor. Is that Member Lynn?
It is. Thank you. I have a question for Carl. On item 4, you talk about non-Alaska residents, Alaskan residents. I'm kind of confused. How can you have a non-Alaskan resident? And then it goes through, and it seems to me that this item also conflicts with the next mandate you have up there. I think, to me, there's a conflict between the two of them. Carl, if you could, can you set me straight, please?
Through the mayor, Member Lynn. So when we use the term non-Alaskan resident, it just means somebody that does not have Alaskan residency. Maybe there's a better way to state that, a non-resident, perhaps. If that makes more sense, or you think it offers some clarity, maybe an amendment could be offered to that. But I'm unsure about the conflict that you're talking about. Could you ask that or clarify that?
I might be able to. When I view it as a non-Alaska resident, that would be somebody to me that would could be somebody come up from the lower 48, go to Juneau, for example. That'd be a non-Alaska resident to me, and then come to Petersburg. And if that be the case, then if I'm correct in the way I'm assuming this, then they would have to follow then also when they fly from Juneau to Petersburg, then the next mandate you have on there, so they must be tested again or follow that process?
Oh, I think I can answer your question, Member Lynn. So so this number 4 in the intrastate mandate does reference Health Advisory number 3, which is the state's interstate health advisory. So basically what we're saying is that non-residents, people that are not a resident of Alaska, who travel into Alaska but not into Petersburg, say they came into Juneau and spent a couple days there, we're saying that they should follow the state's health advisory for interstate travel at their stop in Juneau. When they continue on to Petersburg, then they fall into our intrastate mandate. Does that help?
Thank you.
Clarify?
That does help.
Okay, thank you, Carl, for that explanation and the question, Member Lynn. Any other discussion on this action item?
Mr. Mayor?
Health Mandate 9. Member Mucci.
Yeah, thank you, Mr. Mayor. I guess the question to Carl, on either, we can get to 10 certainly next, but on mandate 9, does this change anything up at the airport? Are we making things more restrictive or just continuing the way things are? Thank you.
Through the mayor, Member Mucci, things are very similar to what we've had in place for a number of months now. And the only difference that I would call out that is really worth mentioning is that there is a nod in both of these travel mandates to the vaccination process. The EOC is acknowledging that vaccinated persons offer less of a risk to the community than a non-vaccinated person. So there is very little difference, to be honest, but the slight difference is that the expectation for vaccinated travelers is that they avoid or they practice good social distancing until they get a negative test result back from their arrival, as opposed to a non-vaccinated person who should practice good social distancing for at least 5 days and have a negative test result back. But that's really the only difference between those two. So it's a slight nod to vaccination, but not definitely not a free pass to anybody that's vaccinated.
Thank you very much.
Okay. Any other discussion?
Yeah, Mr. Mayor, if I could, I'd like to follow up to Member Mucci's question.
Sure.
Carl, so if to follow up to that question, so if somebody chooses to come in to Petersburg, and that person goes through your portal there and chooses not to be tested, we're not going to put them in handcuffs or anything else. It's their choice of what they want to do, and they can choose. And as this health advisory, you call it a mandate, but calls for, then they can choose what they want to do, how they want to proceed. Am I correct?
Through the mayor, there are a lot of options in the. We're still utilizing the state's online travel portal application, phone application, and there are lots of options in that portal app to use, and they are reflected in these mandates. If somebody does not want to be tested, they can select a 14-day quarantine to avoid that test. But I think the more direct answer to your question about if somebody just does not want to participate at all in the mandate at the airport, there is not a provision in this for detaining someone or forcing them to participate. We will try to keep the best log that we can of people that do not want to participate, and that's the best we can do.
Okay. Thank you. And a follow-up question to that: does the state intend to keep that portal open and to operate it, even without the emergency declaration going away?
Through the mayor, yes, I believe so. As long as the state is honoring the airport screening and testing contracts that are deployed at 13 different airports across the state, as long as the contracts are honored, they will continue to update and maintain the online travel portal.
Okay. Thank you.
Any other discussion on public health mandate number? I've got just one little bit of input from me. I mean, I'm going to vote in favor of this, and I'm going to I think we should keep an eye on the state funding, and it looks like it's in effect until June 30th. So we might be revisiting this in the middle of this summer, early this summer. So if the funding goes away, it might be a whole nother discussion for me. So is there any other discussion on this mandate? Clerk, call the roll.
Jeff?
Yes.
Bob?
Yes.
Dave?
Yes.
Chelsea?
Yes.
Mark,
Yes.
Jay.
Yes.
Thank you.
Okay, Petersburg Borough Public Health Mandate number 9, interstate travel testing passes unanimously, 6-0. That brings us to the last action item on today's agenda, E, Petersburg Borough Public Health Mandate number 10, interstate and international traveler testing. I'd entertain a motion to adopt this public health mandate.
So moved.
So moved.
Is there I'll just take one of those moves in a second. Okay, Member Mucci made the motion, Member Stanton Gregor seconded it. Discussion on public health mandate number 10.
Sure, Mr. Mayor.
Member Stanton Gregor.
Yeah, just briefly, I wanted to thank Director Hagerman for the accurate clarifiers to Member Lynn there on discussing the previous one. And my reasons for voting for this one are exactly the same. I think it's, as you touched on, Mr. Mayor, we've got the funding for this and it runs to the end of June. It makes sense to way to protect our community and just give people a free resource for the testing that most of them want. So I'll definitely be voting yes. Thanks.
Any other discussion on public health mandate number 10?
Mr. Mayor?
Yes, Mr. Mayor.
Member Mucci, then Member Kensinger. Member Mucci?
Yeah, thank you, Mr. Mayor. I guess a question to Carl, does this change anything that's been going on at the airport now, similar to the last question I had? I mean, is this just continuing on? Thank you.
Yeah, through the mayor, that's right. It's basically a continuation of the state's mandate. We did amend some of the language to match up better with they had updated their health advisory that deals with interstate travel, and so we had used some of their language on that to try and stay current with what the state desires are. But this is a local mandate, not a state mandate. So we just tried to stay consistent with the state's direction on this, and the goal was to continue on with the testing of people coming into Petersburg from out of state.
Thank you.
Member Kensinger.
Yes, Mr. Mayor, this mandate 10 and mandate number 9, I think, are both similar in their intent, which is to identify cases before they become established in our community. And I think of all the mandates that we're talking about today, both of these are the most important, and I'll definitely be supporting this.
Okay, thank you. Any other discussion on public health mandate number 10?
Yeah, one last question, Mr. Mayor, if I could.
Member Lynn?
Yeah, for the record, Carl, I would assume your answer to me on the last question about how this handled at the airport would be the same for this mandate number 10?
Could you clarify that question, please? I'm sorry. I'm not sure what you're asking.
What I heard on the mandate for the Alaska travel is that if somebody comes to the airport, we are not going to forcibly. They have a choice of what they want to do, and we will not do any kind of police enforcement. I assume. Let me change that. Would that also apply to this mandate we're working on? If somebody walks in here and chooses not to, we are not going to be forcibly trying to do it.
That's correct, unless the assembly wants that to be different. In the way it was at the airport before the state's declaration expired, we did have an officer available when they didn't have anything else going on. To be up there to support the greeting and screening and testing employees at the tent. And, so that would continue to be done in the same manner unless the assembly wanted that changed. But again, there's no intention at this point to strictly enforce this and detain anybody and force them to test at the airport.
Okay, thank you.
Any other discussion today on public health mandate number 10? Will the clerk please call the roll?
Chelsea,
Yes.
Mark,
Yes.
Dave,
Yes.
Bob,
Yes.
Jay,
Yes.
Jeff,
Yes.
Okay, public health mandate number 10 passes unanimously, and that's interstate and international travel testing. That brings us to communications, and Member Mucci wanted to discuss the communication that the Assembly got, and I do not see it on today's, under the correspondence received. It was received probably after this agenda was put together. But Member Mucci, you have some comments on particular correspondence?
Thank you, Mr. Mayor. Yes, I do. Over the last couple of days, we've been, actually many months, we've been wrestling with mandates and this COVID stuff. And, when the public comments to us during their visitors' views, related or unrelated, you always use the preamble that, you want the comments to be cordial and respectful. And, it appears to me that there's a few of these letters that we're getting that have taken on a different tone. I'm not saying they're threatening, but they have a different tone to it. And I would encourage the public to go on to the Borough website and just read these letters and understand some of the thoughts and the positions that we're getting from people. There's somebody, I'm not going to say this person's name, but the quote is that you're a poison and therefore need to be removed. You can think that stuff, and I guess you can write that stuff if you want. That's your freedom of speech. But, honestly, I think we're all just trying to do the best we can, and, a little bit of respect goes a long way. This person continues to write us more or less inflammatory statements, and, we're being accused of being lunatics and need to be unseated. And I would just encourage the public to reach out and see some of these letters that we're getting and just kind of really appreciate what's going on. When Member Tremblay is being told to go back to Portland, and this, it's really unfortunate. We see fires in town or people who are sick, and the community just bends over backwards to kind of take care of each other. But there are some folks in town who think that we're trying to do some stuff that I honestly don't think so, but, that's their right to say so. And there's a few folks I can't respond to anymore because it's just not, it's not productive, and that's too bad. But I'm just encouraging the public to kind of pay attention to some of the letters we're getting so they can see what's out there. So thank you very much.
you must be muted, Mark.
I am muted. If there's no other communications Assembly members would like to bring forward today, I would entertain a motion to adjourn.
So moved.
Second.
Okay, motion's been made to adjourn with the second. All those in favor say aye.
Aye.
Opposed? Okay, we will adjourn today's special meeting. Thanks everybody for their call in today and for their Assembly members' participation. And have a good day.